Welcome back. Government has spent 8 crore 26 lakh 7,352 rupees on ministers in the last 2 years, whereas 10 lakh 99,826 rupees are spent on ministers' refreshments in the last 3 years. Chief Minister Digambar Kamath has spent the most and Transport Minister Sudhin Dhavlikar has spent the least.
Chief Minister Digambar Kamath in his reply to the House has said that in the last 2 years, government has spent 8 crore 26 lakh 7,352 rupees on ministers. Government had spent 59 lakh 75,409 rupees on CM, followed by Health Minister Vishwajit Rane with 11 lakh 5,603 rupees. Home Minister Ravi Naik's expenditure in the last 2 years has amounted to 4 lakh 31,927 rupees. In the last 3 years, government has spent 10 lakh 99,826 rupees on ministers' refreshments. In 2007-2008, government has spent 3 lakh 68,785 rupees on ministers in Chai Pani. In 2008-2009, government has spent 3 lakh 55,024 rupees, followed by 3 lakh 76,017 rupees in 2009-2010 till March. Chief Minister has topped the list by spending more than 59 lakh rupees, whereas Transport Minister Sudhin Dhavlikar has spent the minimum. He has spent 26,884 rupees. Other most expensive ministers are PWD Minister Churchill Alemau with 1,78,812 rupees, followed by former Tourism Minister Mickey Pacheco with 1,36,942 rupees, and former Finance Minister Dayanand Narvekar with 1,14,191 rupees. Our principal correspondent Murari Shetye with Greta Menezes for Prudent Media.
Now, keeping in tune with some more statistics, Goa has witnessed 19,778 accidents in the last 3 years. 961 people have lost their life from 2007 to 2009 and 10,218 people have encountered injuries. Accident rate in Goa is very constant in the last 3 years. These statistics are based on the reply tabled by the Home Minister Ravi Naik in the Assembly.
On an average, every day one person loses his life in road accidents in Goa. In the last 3 years, 9,078 people have lost their lives in accidents. In 2007, 322 people have died in road accidents. In 2008, the number is 318, and in 2009, it is 321. Similarly, in the last 3 years, 10,218 people have suffered injuries in road accidents. Year 2007, 3,128 people got injured in Goa. In 2008, the figure reached 3,167, and in 2009, it slightly came down to 2,962. In 2009, November, December and January had witnessed highest number of accidents. In January 2009, 390 persons met with accidents, followed with November and December with 371 and 455 respectively. Similarly, in 2009, July and August and June witnessed least number of accidents in the state. In July, 2,075 accident cases were reported by the traffic cell, followed with August and June. Our principal correspondent Murari Shetye with Greta Menezes for Prudent Media.
An 11-day-old baby with erotic arch interruption disease survived. Thanks to the efforts of GMC and Manipal Hospital doctors, the baby was diagnosed with a dreaded and rare kind of a disease which requires the short-circuit arteries to be kept open so that the half of the lower part of the body can get blood flow. In the rarest of times, such cases are successful. This was one of those rarest successes.
This is the baby stricken with poverty and disease. The baby was suffering from a very indifferent and rare kind of disease. It is known as the erotic arch interruption. The infant had to undergo a major and costly operation. The father of the child is a plumber and had no mediclaim or income to operate the child. But thanks to the doctors and others who contributed to save life of the child was sent to Manipal for a surgery. The child had a kidney problem and was under a shock. The child is now fit and healthy after a smooth post-operative surgery.
These kids require some kind of, I would say, short circuit artery, which is in all of us called as ductus arteriosus, to be deliberately kept open so that the lower half of our body gets the perfusion, the blood flow. The main aorta, which should otherwise supply the blood, is cut off at certain level. So we usually give an expensive medicine called prostaglandin E1, which is given as a continuous medication to keep this short circuit deliberately open so that child will survive for a couple of more days until he gets a surgery.
Dr. N.S. Devanand congratulated all the young doctors of GMC for their efforts.
Now, what I would want to tell through this is that the greatness, some of these younger doctors who are shown in GMC, that is something which is absolutely noteworthy in this current era where medicine is taking a different direction.
A reporter in Panji, Jason Suarez, with video journalist Omkar Farari.
Goa has detected 2 H1N1 suspected patients. H1N1 influenza is also known as swine flu. These patients had not travelled outside the state. Swab samples of both the patients will be sent for examination to Delhi soon. One patient is from North Goa, while the other is from South. Government has directed all to take precautionary measures in this regard.
2 patients are suspected with H1N1 influenza in the state. They were detected on Thursday and Friday respectively. The patients are from North and South Goa. They had not travelled outside the state. Currently, both the patients are undergoing treatment at 2 different hospitals. State epidemiologist Dr. Jose Dissa gave us more details about the patients.
2 samples being referred from the private doctors, one from South Goa, that is from Margao Hospital, and one from Panji Hospital. So 2 samples of 2 suspected cases we have received, and these samples we are sending to Delhi for testing. Now these are only suspected cases, and we'll get the report after the samples are tested for swine flu.
It is a known fact that since January 2010 to June 2010, 12 cases of H1N1 influenza were suspected, out of which 3 cases were confirmed. All 3 cases were from Goa.
This year we had 3 positive cases. One was in month of January, one was in the month of March, and the third case was in the month of May.
Last year during monsoon, Goa was terrified with swine flu influenza. All the people were asked to use safety masks while travelling and visiting clinics and hospitals. To avoid any such kind of disaster again, government has directed all the schools and institutions to take precautionary measures related to swine flu.
All the precautionary measures are being taken, just like how we were taking last year. Our surveillance mechanism and also our educational programs, especially in schools and all, through the Director of Education, all the instructions have gone to the schools.
A reporter in Panji, Lokik Shilkar.
Watch our very own Goan footballers take to the ramp after we come back from a short break. News from sports on the other side. Stay tuned.